So thank you for the invitation, and thank you to those who've organised this. And it's been a long journey, but it's nice to meet you tonight. I'm going to talk mainly about the National Health Service, about the situation. The reason the book is titled The NHS After 60 is because July the 5th this year is the 60th birthday of the National Health Service in the UK. Obviously there's a whole series of issues arising out of that, particularly for us in England, where we have the Westminster Parliament running roughshod over our National Health Service, introducing a whole series of policies, a number of which you're delightfully excluded from over here, and you don't actually have to put up with. But I will outline them as to why we're worried, because obviously it might not be the case that it's permanently isolated from what takes place here. Why do we celebrate the National Health Service? Because when Anarin Bevan, who was of course a Welsh left-wing Labour MP who became Minister of Health in the post-war government, when he pushed through the legislation that set up the National Health Service in the UK, it was, I think in most people's view, if you think about it, the great modernisation, because it was the first time in Britain, and in many parts it was pretty well unique around the world at the time, in breaking from a market system for providing healthcare. For the first time you could access healthcare on the basis of your need for healthcare, not on the basis of your ability to pay, not on the basis of having prepaid any insurance. There was no qualification period. All of those things which are tied in with private insurance and limited exclusive insurance schemes, all of those were swept away for the very first time. So for the very first time, again, what was in England and most of the UK a really ramshackle network. You have municipal hospitals, voluntary sector hospitals, charitable hospitals, private hospitals, largely private GPs charging fees, treating some patients who are covered by national health insurance and by trade union insurance schemes on a panel which was actually second-class citizens. All the panel patients went into one room, all the private patients went quite often to another building or into a completely separate facilities. All of that was broken down. Bevan nationalised the hospital network and brought the whole hospital network into one structure for the very first time. That meant, although all the hospitals tended to be relatively small buildings, they were nowhere near modern size in terms of the ability to develop modern services, you could get smaller hospitals that could for the first time work together. Hospitals that were in from separate systems, charitable hospitals and municipal hospitals in the same area, that previously been completely separate, could begin to pool resources, could actually share specialist staff and these type of things. So you have the development out of this of a national system for training doctors, a national system for training nursing staff, and the development of modern medicine in a genuine concerted way across the country. Now, it wasn't perfect. There were a lot of things wrong with it, particularly starting from the very low base. A lot of these hospitals were in desperately poor repair. A lot of them were very small, they weren't really suitable for modern medicine. So there were a lot of things, and it was 20 years before they really started building substantial numbers of new hospitals to actually replace the old buildings, a lot of which dated right back to the middle of the 19th century. So all kinds of problems and limitations, but it really was a modernisation, a stride forward. For the first time, healthcare was no longer a commodity which you had to check in your pocket if you could afford it or not, or if you were covered for it or not. It was something taken out of that process altogether. That's why I think we've got a lot to celebrate. In that first year of the National Health Service, the total bill for the National Health Service was £409 million, right? And that was a massive overspend on what had been allowed for the first year, because nobody knew how much it cost to run a National Health Service. All kinds of things ran out. It was post-war period, there was rationing, there were desperate shortages. They ran out of supplies of spectacles. They actually had overspent their budget by 20 times what they expected to spend. And this was just a huge pent-up level of demand for people who couldn't possibly afford them under the old system, who suddenly came forward wanting their treatment. Working class women who'd been excluded from insurance and hadn't been able to access gynecology services and so on, suddenly came forward with all kinds of long-standing problems that needed treatment. So the NHS began with a waiting list. It began with a deficit, it began with shortages, and it's always been behind trying to catch up ever since. So we've got stuff to celebrate, and we've got things, and you know, if we look at the National Health Service today, the current budget is something like £105 billion this current financial year. So if you like multiply up in real terms, it's gone up something like 10 times faster than the general rate of inflation, and the spending has gone forward. But it's only just in Britain reaching the level of European average spending on the National Health Service, and that's in the last few years. So for most of the first 50 years of the NHS, it was spending well below the European average, the advanced countries' average on health. And so all the things they're saying, oh, well, the NHS, you've still got these waiting times and you've got all this, that was very much because it was underfunded, under-resourced, and compared to comparable countries that you were trying to say, oh, look, you don't have to wait so long in France. Well, you don't, but they spend 10.5% of their gross domestic product on health, and they have for a long time. And the health service not only spends 10.5% of their gross domestic product, in other words, national wealth, not only spends far more than we do in terms of the share of national wealth, but also overspends and runs massive billion franc or billion euro, multi-billion euro deficits, and is still doing so. So you have very different scenarios to compare with across Europe. So when we look at today's situation, today as we come up to the 60th anniversary, why are we concerned? Well, we're concerned because right up until 1988, the 40th anniversary of the NHS, the basic structure of the NHS pretty much remained as Nye Bevan set it up. They'd reorganised it a bit, but basically it was still organised through appointed health authorities running a service in which they had some local discretion, but generally it was a nationally shaped service. Margaret Thatcher came along and said what we want in 1989, 88, 89, came forward with a whole series of proposals to develop what they called an internal market. This is the idea that you give all the money to health authorities, and these are separated out from the hospital providers and from other providers, mental health and other services. So the health authorities purchase services, and you have contracts, and you have the notion of a market and competition between different providers for a share of spending. At the time, all of us protested very strongly against this. There was massive protests, there were big campaigns against it. There were big campaigns against individual hospitals becoming what they call NHS trusts, in other words, opting out and so forth. And the BMA, the British Medical Association, which had opposed the NHS back in 1948, came out as a defender of the NHS against Margaret Thatcher's principles, and the trade unions opposed it, and there was a big campaign. And we didn't win, and Thatcher forced through these reforms, and the internal market was set up. But the internal market, I always tell my students not to do that, the internal market situation was a much more expensive way of organising it, but it was circulating the money within the NHS. There was competition between different NHS providers, and one might win and one might lose, and we thought this was a very ineffective way to actually organise treatment, but it was nothing compared to the type of changes that we've had in the last 8 years under the new Labour government. In 1997, Tony Blair came to office, and he was promising to sweep away what he called the costly and bureaucratic market system in the National Health Service. And Tony Blair said, we have 10 days to save the National Health Service. Yeah? And we had that countdown, and everybody, oh, you know, thank goodness we swept away the Thatcherites, you know, the people who want to privatise our healthcare, and we brought in a new Labour government. And for 3 years, the new Labour government stuck exactly to the same spending limits the Tories had introduced, and the same policies. All the services that had been privatised under Thatcher, the cleaning, the catering, the portering and security and all these things, car parking, all these things that had been privatised under Thatcher stayed privatised. And most of them around most of England still are. So not much changed on that front. What did change was that they decided they wanted to build some new hospitals. And they had bought, in the final year or so, in the run-up to the 1997 election, the Labour Party had signed up to a Conservative Party policy which was called the Private Finance Initiative, where you get the money put forward by private companies to build, design, build, finance and operate. DFBO, design, finance, build and operate new hospitals. And one of the reasons that it had been criticised by the trade unions consistently and by the Labour Party, right up until 1996, was because it's a very expensive way to deliver funding for new hospitals, compared with the government borrowing the money and lending it to the hospitals to carry out the building work. And anyway, New Labour decided this was the way forward, and they signed the first deals. The Tories had never managed to actually build a PFI hospital. Labour came forward and started to build PFI, privately financed hospitals. We're now currently in the moment where deals are going ahead, or hospitals are already open, to the tune of £8 billion. £8 billion worth of hospital projects. According to the government's own figures and projections, these are set to cost £53 billion over the lifetime of these PFI contracts. You pay it over 30 to 40, sometimes 50 to 60 years. £8 billion worth of hospitals set to cost £53 billion. And out of that, by all the calculations, it looks like something in the region of £27 billion is clear profit for the private sector. Now, the first deals that Frank Dobson signed as Health Secretary in the late 1990s were nothing compared to the scale of the deals that are coming down the line now. I mean, they've mushroomed out of all proportion. They're doing one in Birmingham, just up the road where I'm going to be flying back into shortly, £700 million for a new hospital complex and including a mental health unit. In London, we've got the Barts and Royal London, which is coming in just over £1 billion. It's been cut back to £1 billion. It went up substantially more. It's come back down. These are the headline costs, but they don't actually give a full figure, because you can basically, with any PFI hospital, you can multiply the headline cost by 5 is what you pay. So if it looks like it's £1 billion, you're going to be paying around £5 billion by the time you've actually finished. And it's index linked. So as inflation comes back up again now, so do the PFI payments. Year by year, index linked. The private sector stands to lose nothing. It's absolutely guaranteed. These are legally binding payments. They're the first thing the trust has to pay. Whether or not they treat any patients, they have to pay for these new PFI hospitals. So that's the first thing. We had PFI. Then in 2000, we had what was called the NHS Plan. And Alan Milburn came forward, as Health Secretary, came forward with the NHS Plan, which was to spend more money. Tony Blair announced there was going to be more money. They were going to increase NHS spending towards the European average. So there's going to be more money. So the NHS Plan was how this money would be spent. In the NHS Plan was foundation hospitals, which in other words, you float off NHS trusts and you make them effectively self-contained businesses, no longer accountable within the NHS structures, accountable only upwards to a regulator who is actually in theory accountable to Parliament, called Monitor. Okay? These came in at the end of 2003, beginning of 2004. The legislation was pushed through then. We now have something in the region of 80 foundation trusts all in England. We haven't got anywhere else. Scotland and Wales decided not to, though the Scottish and Welsh Labour MPs went into the lobbies and voted it through. It went through by a majority of 17. The Scottish and Welsh Labour MPs voted for it knowing there weren't going to be any in Scotland and Wales. I don't think you've got any here either, and it's unlikely you're ever going to have any. So it's an England thing, but it's these foundation trusts were the best and most successful hospitals in the first instance, and they've then been given additional freedoms and privileges. And they are now sat between them on a surplus of in excess of £2 billion of unspent money, which is now no longer available for any other use within the NHS because they're in the reserves of foundation trusts, which are no longer organisationally actually part of the NHS. So this is a huge, huge shoot in the foot for any prospect of planning services at a local level. Foundation trust. Second thing was the use of the private sector to deliver more treatment for elective services. In other words, waiting list services. Why waiting list services? Because of course the private sector is not interested in delivering emergency services and won't deliver emergency services because there's no money in it. Wherever possible, they get away from doing it in America. Wherever possible, they get away from doing it around the world. They deliver elective services for areas which are safe, which are low risk, high turnover, and big margins. And that's what they're interested in. New Labour came along and has created a brand new private sector in England delivering these, they call them independent sector treatment centres now. And they've set up a whole network of these who are guaranteed contracts for 5 years ahead, regardless of how few patients actually they treat. They get paid a fixed amount, and they get, again, index linked, and they're on average getting upwards up to about 12% more on average than NHS standard tariff. So in other words, for every 9 patients you treat in a private sector treatment centre, you could have treated 10 through the NHS. So the idea was that this was going to provide additional capacity to help reduce waiting lists. Except that this hasn't happened at all, because what's happened is these new treatment centres have come along the line and they've simply poached patients and work and money from the existing NHS trusts. And we now have a situation where the treatment centres are growing and the NHS trusts are running into major crises. Then we have the decision to contract out more diagnostic work, MRI scans, CT scans and so forth, again to private companies. A company that's actually very closely linked with Alan Milburn, the former Health Secretary, actually landed a contract, Allied Medical, and they're going around in caravans, parking in hospital car parks, literally delivering MRI scans off the back of a lorry. And that is going on at the moment. And then, of course, we have this government becoming increasingly infatuated with the idea that the private sector is somehow the solution to the problem. So we now have them wheeling in private management consultants who are now in virtually every single boardroom of every single trust up and down the country, actually advising somehow on how to run an NHS, when of course the private sector has such a lamentable record of running healthcare services anywhere in the world. And of course they're also looking at bringing in, they've now drawn up a list of 14 companies, including 4 of the top American insurers, to come and advise primary care trusts, which are now the bodies which hold the budgets, as to how they should commission services for their population. Now, these American insurers have got where they are today by excluding people from care. They got where they are today by denying people, if you watch the Michael Moore film, The Sicko, by denying people the care they've already paid for under insurance. And they're being invited in now to actually advise NHS bodies, which are supposed to care for a whole population, on how to run services. So we have that, and now on top of that we have United Health as the biggest corporation involved. This is the most profitable of the American insurers, health insurers. They've been brought in, other companies are now coming behind them to take over the running of primary care, GP services, across whole chunks of England, despite the fact that there are growing campaigns to stop this actually happening. Now these are some of the reasons, and I haven't outlined the whole lot, these are some of the reasons why we're very concerned that 60 years after the historic modernisation swept away a market, we now have New Labour quite consciously creating a new market, in which, in order to ensure that these private sector companies can get their money for each item of treatment, they've brought in a whole new system of paying the hospitals for the work that they do, called payment by results, which is a cost per case system. It's nothing to do with results. They get paid the same amount whether the patient jogs out in a tracksuit or carried out in a box. You know, it's not to do with results, it's to do with the fact that it's cost per case, it's a fixed tariff that is paid. But of course every patient is diverted to a private sector provider from an NHS, through the NHS, takes the money with them out of the NHS. So the local NHS loses that money and the private sector can use it to pay dividends to shareholders who can spend it on caviar and yachts. Okay? So you have this system which has come forward. This is 60 years since the commodification of healthcare stopped. We now have, because of payment by results, every item of treatment is a cash value. Back again. It's a cash value. You are now, whatever it is, £240.50 to somebody who knows they can do this number of tests on you and so forth. That's what you are. You're now cash value. If you're a hip operation, you're £5,000. You know, you're a cash value. And that whole notion that it's actually now patient-focused care has been replaced effectively by surplus-focused care, because the central order going out now from the National Health Service, Department of Health, each trust has to turn in a surplus. You have to run on a surplus. Across the whole NHS, it's more than £3 billion now in surplus. This is money that was allocated for patient care that's now sitting in bank accounts and savings accounts up and down the country unspent in order to satisfy ministers' targets. So we're saying 60 years after We had so much to celebrate, more money than ever before, undreamed of amounts are being spent. The NHS has expanded, is delivering very important services. We wouldn't want to be without it, but it is being chipped away at, the fundamentals are being attacked. And we still have, we have this revival, artificial revival, of a new private sector for which there is no objective market basis. It couldn't function in a normal market system. It can only function on the basis that the Labour government has decided to allocate and switch all that money in order to foster its growth. So that's why we're very concerned, and we're saying, yes, let's defend the NHS by ensuring that we fight for a return to the kind of principles that underlay it in the first instance: collective provision, universal health care, public provision, publicly provided, publicly accountable. Unless we can have that back, then the principles and the gains of our National Health Service are really at risk. So I'm sorry if it all seems a little bit one removed, but that's the kind of, in England, which is the bigger population in the UK, this is the issue. And you know, the fact that you've now got a Northern Ireland Assembly that's got autonomy over health, I do a lot of work in London. They've got a population of 7 million in London who's got no autonomy over their healthcare whatsoever. Scotland, they've got a parliament deciding their health policy. London's got a bigger population and no autonomy over health policy. Wales has got a national assembly, has abolished prescription charges. We're still paying £7 an item in England for our prescriptions, and no prospect of those being abolished. I noticed the unionist parties are among those who are actually calling for the abolition of prescription charges here. Maybe that's one of the things they negotiated as a deal for for bailing out Gordon Brown yesterday. But the fact is, we stand no chance of getting it in England, and that's why we still think the core of the National Health Service in England is at risk, and that's why I'm out sort of on the stump trying to do something about it. Thanks very much.